My name is Shelley Adler, and I am the director of the UCSF Osher Center for Integrative Health. And today it's my great pleasure to introduce 4 people who will be discussing the extremely significant issue of cultural appropriation in integrative medicine and health. So I'll introduce the 4 of them briefly now and then turn it over to the moderator for today's discussion, who is Dr. Maria Chao. Dr. Chao is Associate Director of Research and Associate Director for Health Equity and Diversity at the Osher Center. She's Associate Professor in the Division of General Internal Medicine at Zuckerberg San Francisco General Hospital. Dr. Chao's research focuses on how complementary and integrative health approaches can advance health equity and improve quality of life among underserved populations living with chronic conditions. Our first speaker will be Helen Yi, a licensed acupuncturist and integrative Chinese medicine practitioner at the Osher Center. She recently launched a fantastic pilot program that provides group acupuncture treatment for patients who are historically undertreated for pain. She specializes in stress management and women's health and treats patients with complex health histories, including people with immune dysfunction, digestive disorders, pain, and those in hospice care. Our second speaker will be Dr. Helen Weng, a research associate affiliated with the Osher Center. She's a clinical psychologist and neuroscientist. Dr. Weng joined the Osher Center for Integrative Health as a postdoctoral research fellow and was then brought on as assistant professor of psychiatry and behavioral sciences. Much of Dr. Weng's work focuses on increasing the diversity of meditators within neuroscience studies, including racial and ethnic minorities, people within the LGBTQ population, and people with disabilities. Our final speaker is Dr. Sudha Prathikanti, a clinical professor in the UCSF Department of Psychiatry. She's also the head of the Integrative Psychiatry Teaching Clinic at the Osher Center. Dr. Prathikanti is also a medical director for primary care adult psychiatry at Zuckerberg San Francisco General Hospital, where she consults primary care physicians on the diagnosis and treatment of outpatient mental health problems. Dr. Prathikanti's research focuses on holistic mental health interventions that are accessible to vulnerable populations from a variety of cultural backgrounds. So the order of today is we will hear a brief presentation from each panelist, followed by a discussion facilitated by Dr. Chao. So for any questions or comments you have, please direct them to Maria Chao by way of the chat feature, and do that at any time during the presentation. Then at the end, you can also pose questions directly to our speakers during the discussion. And last but not least, I want to thank our Grand Rounds Planning Committee and all of our facilitators of this work, Drs. Anand Dhruva, Selena Chan, Sarah Peterson, Patty Moran, Yvette Coulter, Jen Shea, and Julia Burns. So please join me now in welcoming our wonderful panel. Thanks for being here, everyone.
Thank you so much, Shelley. Good morning, everyone. Extra special thank you to Selena, who organized today's session, put lots of effort into herding cats and behind the scenes communication. To get us started, I will define the concept of cultural appropriation and also the scope of what we hope to cover today before handing it over to our panelists. So, give us 1 second while we get our screen share up. So, what is cultural appropriation? Hang on for 1 second. Sorry, everyone. Here we go. So in a recent article in the psychology and counseling literature, Mead and colleagues provide this simple but very poignant definition. They say that cultural appropriation is the theft of sacred items or practices while simultaneously profiting from their misuse. In the popular media, poet and filmmaker Fatima Asghar unpacks this a bit more, saying that cultural appropriation occurs when members of a dominant group take elements and symbols of another culture for their own economic or social gain, while simultaneously devaluing and censoring the bodies, opinions, and voices of the oppressed culture. So distinct from cultural exchange or cultural appreciation or cultural adaptation, these definitions really highlight relational aspects of power dynamics and imbalances as core to cultural appropriation. And although it's not explicitly named, sociocultural biases are also at play. What and who is valued, ethnocentrism, and racism. So in our globally connected world, cultural appropriation can touch so many facets of our lives, and the scope and complexity of cultural appropriation are quite vast. So in terms of our scope, our purpose today is certainly not to be comprehensive about this topic. Some of what we're not covering today, we're not discussing whether or not cultural appropriation exists. We're also not really getting into the nuances of the best terminology. We also recognize that internationally, there's ongoing critical discourse on policy, regulatory, and licensing issues around traditional healers, and lots of complexity around the ethical considerations of Indigenous healing knowledge. Those are all so important and outside of our scope today. Our scope is actually much more narrow. We're focusing on how does cultural appropriation show up in integrative healthcare spaces, particularly in the United States, and what can we do about it? It's part of an ongoing conversation we've had within our working group for diversity, equity, and inclusion, a series on cultural appropriation. The broader OSHR collaborative has also had a workshop on this topic, recognizing that cultural appropriation is quite common and perhaps inherent in integrative medicine. So sort of as a specific site of tension within our field, what's our role and responsibility as integrative medicine professionals, and how do we keep this conversation alive? How do we engage in ongoing practice to cultivate awareness, self-reflection, compassion for one another, and hopefully to cultivate skills to better navigate some of these thorny issues? So with that in mind, our panelists today will be, excuse me, addressing some specific examples of cultural appropriation that we see within integrative medicine, particularly in the fields of acupuncture, yoga, and mindfulness. They'll also each talk about the harms that are caused as a result of cultural appropriation. So discussing how practices have been commercialized and decontextualized, and also topics of representation and marginalization, thinking about questions like who are the experts and whose voices are missing. So with that, I will pass it to our first panelist, Helen.
Thank you, Maria. So I am a Chinese woman practicing East Asian medicine. My family is from the Pacific Islands in China. I have lived experience in North America. One of the hottest topics on cultural appropriation in East Asian medicine is whether a non-Asian practitioner, particularly a white practitioner, is culturally appropriating this healing practice. My answer really depends on whether the individual is disrespecting the individuals practicing this, the culture, or trying to use it for personal gain. For the most part, I personally have not directly experienced cultural appropriation by my non-Asian peers. Some of my other colleagues, unfortunately, have witnessed blatant disrespect of Asians, Asian practitioners, Asian cultures, and have sought out to seek personal gain by utilizing some of the practices in East Asian medicine. One of the examples I wanted to point out is a white East Asian medicine practitioner in Oregon who's dubbed herself the Queen of Kanji by modernizing the tradition of kanji. What is kanji? Kanji is a rice porridge that commonly is used in everyday types of meals at homes, offered in restaurants all over Asia and Pacific Islanders and in many other places in the world, and here in the United States. It is also something that we offer and recommend in our East Asian medicine practices for particular conditions and situations. Sometimes people feel Asian practitioners are better than non-Asian practitioners, and this is an area I want to touch on as well too. I disagree with this. I feel there are many good practitioners in any field, regardless of their ethnic backgrounds. Likewise, I've heard other patients, individuals, preferring to see white practitioners because they feel they are better practitioners. So these are just a couple of areas I want to touch on as we start this conversation on cultural appropriation. There are many examples of cultural appropriation in the practice of East Asian medicine. For those who are not so familiar with East Asian medicine, also more commonly known by some circles as traditional Chinese medicine, includes some of the tools that are commonly known as acupuncture, cupping, herbs, manual therapies, gua sha, dietary therapies, and lifestyle recommendations. In our limited time today, I will only focus on just a handful. And please know what I share today is from my perspective. I would like to start with PTNS. PTNS stands for percutaneous tibial nerve stimulation. This is the utilization of a particular point, which is 4 or 5 centimeters above the inner ankle, and it is stimulated with electrostimulation once a week for 30 minutes for 12 weeks. This particular procedure is specifically for a cluster of urinary issues, particularly overactive bladder, urinary frequency, urinary incontinence, and an urgency, to name just a few. The methodology was developed by Dr. Marshall Stoller. The PTNS device was FDA cleared in the year 2000 for the bulk of these urinary conditions, and in 2010 added overactive bladder. As you can see in the upper image of the PTNS procedure, there's an individual receiving this treatment, and down below is an image of a patient receiving electroacupuncture to 4 points on the leg. What's the difference? Well, the difference is the medicalization and the decontextualization and extraction of this one particular point, which we call spleen 6. And in Chinese, it is called San Yin Jiao. And these points, this one point and many other points, have been documented for about 3,000 years in the Yellow Emperor Classics, which is dated to approximately 100 BC. This particular methodology has been in use for quite some time and is only practiced in urology and gynecology clinics. And this procedure can only be done by physicians, physician assistants, nurse practitioners, and clinical nurse specialists. There is no mention of licensed acupuncturists being able to perform this. There's a separate procedure code, which we call CPT codes in the US, and there's reimbursement by both Medicare and Medicaid. There are different voices at the table, and certainly East Asian medicine practitioners' voices are definitely missing. I wanted to share here too that there isn't a lot of acknowledgement that PTNS is derived from East Asian medicine. I did find just a handful of articles that did make mention and acknowledge that this practice does stem from East Asian medicine practice. I did want to highlight this one, which comes from an article in Research and Reports in Urology in the year 2010. It states here in the highlighted text, percutaneous tibial nerve stimulation is derived from acupuncture used in Chinese traditional medicine and was first described in the early 1980s. I really appreciate this as an East Asian medicine practitioner. And it doesn't take a lot of word count to include this one sentence. And I so appreciate this. I did want to share too that in the practice of the PTNS, it gets much more confusing. I received a referral from a patient, or their PCP rather, from the urology clinic who had received a course of PTNS. And the patient was an Asian Pacific Islander woman who wanted to continue PTNS because she had such successful results. She came in and was very confused as to why we were doing such a lengthy intake, even though she was informed that her initial appointment was going to be 90 minutes and did include acupuncture. And so I shared with her, well, you're going to be receiving a comprehensive intake on the various imbalances that you're coming in for your visual issues, your diabetes, digestive issues, and weight gain, just to name a few. And she understood that what she was going to be receiving was not going to be continued PTNS of a singular point or maybe one other point added to it, but that she was going to be held in a completely different paradigm. The other thing I wanted to point out with this particular example is that some other patients who I have seen who have received PTNS, from those of my colleagues, is that there can be harm that can occur with this particular procedure if you don't really know what you're doing. There's not a lot of training for this. I've seen patients who have had nerve damage, pain in an area that they didn't have before. So this is just to elucidate the fact that there is so much that can be contributed with the inclusion of East Asian medicine practitioners in all these different conversations and tables. Let me go to another few quick examples here too. So dry needling is cultural appropriation of acupuncture. Myofascial decompression is cultural appropriation of cupping. The Grasson technique, which is a trademark technique, is cultural appropriation of gua sha. All of these tools here, acupuncture, cupping, and gua sha, is used for all kinds of conditions, internal medicine and external conditions as well too. Gua sha, for those who are not familiar, this is a kind of a skin scraping technique. Dry needling, myofascial decompression, and the Grasson technique. These techniques are often used by those in the pain management world, primarily by physical therapists and chiropractors to name. And these techniques, although from biomedical perspective, has been around for 200 to 300 years from biomedicine history, but their focus on pain and really trying to improve soft tissue and mobility doesn't mean that the effects do not have the similar effects offered in acupuncture, cupping, and gua sha. What I wanted to share here too is that the training is very different. The training requirements are all very different. And because of this, there can be harm done even greater than what was shared in the PTNS example I shared with you. In closing, I want to say there are many large and small examples of cultural appropriation in East Asian medicine. The extraction, medicalization, and the decontextualization of these practices create a lot of confusion for individuals who do not know that these strategies and techniques actually come from a much older whole health healing system. And the fact that there is only a few that benefit from this, and East Asian medicine practitioners not included, really draws another question. With all of this, I did want to state there is an inherent bias in hierarchy of medicine and healing paradigms due to the history and legacy we inherit from our colonial imperialistic past. I do want to thank my colleagues here at UCSF and my colleagues around the country and internationally who I've had the opportunity to speak on this topic and included their examples and comments here. So I do want to thank them. Thank you so very much. I appreciate your time today.
Hi, I'm Helen Weng, and I'll be talking about cultural appropriation and mindfulness, mostly from a first-person perspective. So I do not academically study cultural appropriation. However, being in the mindfulness field for 15 years gives me a lot of experience of what it feels like to be an East Asian American woman within this field. Oh, okay. And so some of you may know that I'm a neuroscientist, study meditation. I did research with functional MRI, which requires extensive training and resources. It intersects with computer science. And so I know like 6 coding languages. The research itself is very expensive. For example, every brain scan I did at UCSF cost $1,200. And so it really is a power language, and I really use the power that being a neuroscience gave me within the field, because there's a lot of social capital for the neuroscientists, to shed light on the fact that there isn't enough diversity in both the scientists that study mindfulness and the participants. And so I partnered with the East Bay Meditation Center and used community engagement to increase the diversity of participants, and I called this intersectional neuroscience. I also use the power of machine learning that's individualized to each person's unique brain, function, and activity in order to start to start to examine what mental states may be happening during meditation. So essentially reading the mind during meditation with brain activity. For this work, I was named one of the 12 powerful women of the mindfulness movement in 2019. And I love that title. It was a huge honor. And at the same time, it was very ironic to me because often I did not feel powerful because of the way people treated me. And so I want to name that mindfulness meditation practices come from Buddhism, which is a religious tradition that originates from Asia. And I am an Asian American where my parents were born in Taiwan and I was raised in the United States, and about 50% of Taiwan is Buddhist. And so scholars name that cultural appropriation and mindfulness involves oppression or an imbalance of power. Some of the dynamics I'll be talking about are extraction of information or decontextualized, and as Maria talked about, also for profit. And there are interpersonal dynamics of dominance, exclusion, and I would argue it's not just being excluded, it's actually with the intention of removing certain voices and faces and people, because in my opinion, that is what happened to me. There's also denial of expertise, which I hear is very strong for mindfulness meditation teachers, that because it comes from a religious tradition, secular mindfulness is viewed as more logical, more scientific, and it was adapted for the medical system with mindfulness-based stress reduction, which I think is wonderful in terms of making it more accessible to more people, people who are in pain. And for a long time, I viewed this as cultural exchange and was very excited by that. However, being in the field for so long, 15, 16 years, it became clear to me over time that this was an example of cultural appropriation, especially because so many Asian voices, faces, presence were lacking within the United States. And I call this the fun trio of cultural appropriation, racism, and sexism. You can't always tease them apart, but I experienced the mixture of all three within academia. And so unfortunately, much of my personal mindfulness practice was applied to awareness of these dynamics in order to navigate academia. I would have not gotten this far without having to deconstruct all the dynamics coming at me and coming up with new ways of interacting, often in a way that was painful for me because I had to start embodying the oppressive dynamics just to survive and to interact with other people in that way so they would take me seriously. And so over the years, I spoke out, I raised awareness, I embodied different research methods, and UCSF really supported that work, so I'm very grateful. And I had so much privilege in the field. I was trained by one of the world experts, and I felt like I had as much privilege and resources as I personally could, but I still had to ultimately leave because it was just too difficult to navigate these dynamics, which I will tell you more about. And so to learn more about racism and sexism in academia, I highly recommend this paper by Williams, Phillips, and Hall, which really breaks down some of the dynamics. As for cultural appropriation, we know in general there is issues with diversity in scientific communities. There's a term for it in the literature called weird people, or Western educated, industrialized, rich, and democratic. And so the way this manifests is, this is a picture of the Mind and Life Institute conference, which I went to every year for many years, and is one of the premier conferences in the mindfulness field. And as you can see, it is not that racially and ethnically diverse. And on top of that, like in 2015, I was maybe one of 3 Asian people out of 200. And I physically, viscerally could not withstand what it feels like to be in that kind of space anymore. And so I told myself this was my last conference with them. But then in 2016, they asked me to present on race and the brain, which is not my area of expertise, but I decided to accept the offer so I could help start to educate my academic community about the issues with diversity. And I would argue that there is an underrepresentation of Asians and Asian Americans within the mindfulness research community, when we know that Asian people are typically not underrepresented in the sciences. And I want us to examine that. And I do believe this is due to cultural appropriation dynamics. And so here's an example of cultural appropriation in the larger media. The face of meditation and mindfulness is often white, often female, and often thin people. And this slide was created by Larry Yang, who is one of the founding members of the East Bay Meditation Center. And he has worked tirelessly to address cultural appropriation in the mindfulness teaching community and has developed programs for teachers of color. So really appreciate his partnership. And so at UCSF, I helped to develop community engagement techniques to do my neuroscience research. I loved it because it was an embodied process involving cultural humility, including people at every step, continuous dialogue, and clarity over time, credit, and compensation. And all these dynamics would be automatic if you're interacting with people with more privileged status. But if you're interacting with people who are underrepresented or maybe appropriated from, the baseline dynamic is going to be oppression. And so I showed this slide in every talk I gave to help guide people in equitable research methods, but it was also an implicit plea for the field to treat me with the same level of respect. And the message was a little too implicit because it mostly did not translate. And so I had to deal with a lot of dynamics. I decided to get some raw data from my email inbox. And this email is from a stranger I'd never met, who is a research assistant, so more junior to me, and a white male. And he essentially emailed me because he wanted my grant so that he could do the work himself. And so I call this the appropriation scorecard. Involves this extraction of intellectual property, exclusion with no credit. And the credit issue is very important to me. That's how I screened through a lot of my interactions. If I was not going to receive some kind of credit or benefit for my work, then obviously I should not engage. Here's another example from a UCSF postdoc that I had never had a real conversation with before, yet I received this email that asked to do analyses on my fMRI data. Again, it's very expensive, resource intensive. I was the PI on the grant. And so I told her in person, I think we should talk about authorship. So I learned from graduate school where people tried to take my data, they tried to take credit for my work, and I was interpersonally bullied. So that created my worldview for what this field is like. And unfortunately, it bore out as I raised up the ranks in academia, the dynamics actually just got stronger, which was surprising to me. However, I learned I have to talk about authorship and credit very upfront, or people are just going to assume that they can extract and exclude me, right? And so her response was, well, let's see how much data you have first. For a principal investigator who raises the money, who designs the study, who collects the data, there should be absolutely no question that they should get authorship if a paper or presentation comes out of it. So you can see how extreme these dynamics are, right? I can't even get basic acknowledgement of credit for my work. This manifests in reviewers. I had to submit my machine learning paper 7 times. However, it is very influential in the field, so it was worth it in the end. But even like publication process is more difficult. Everything is more difficult. And so this reviewer said, I don't see a way to salvage the paper for publication. unless perhaps the entire meditation context is taken out. This is in 2019. By then, I'm already known as a leader in the field. And it just clicked with me in preparing this talk that this is a classic example of denial of expertise. The only way to make the paper better is to take my area of expertise out of it. And so I ultimately did not, resubmit to this journal. It took some more time, but you can see, I found this comment quite hostile, honestly. And it's just very demoralizing to encounter dynamics from all sides every day. And so I was verbally abused at conferences. So this person argued with me that my methods were not sound. He kept attacking me until I was in tears. And then he said, Helen, you seem really unhappy. Maybe academia isn't right for you. So if you ever wonder why the field might be lacking people of color, women of color, Asian people within mindfulness, you just have to go, just ask people, just talk to them. They'll tell you story after story like this. It's really disturbing. And so after verbally attacking me, he kept emailing me and emailed me about 2 years later once my work bore fruit. I had a preprint out. So he asked both for my machine learning methods, which he had attacked. And then he asked for free diversity, equity, and inclusion work to recruit diverse participants for his study with 1 day's notice. And so there's also a lot of time microaggressions. And so that embodied everything that I screened for to say yes or no. And unfortunately, this kind of internal screening I always did screened out about 95% of collaborations and requests. So I ended up being very exhausted and I couldn't really see a future in academia. And I actually have called this the tidal wave or tsunami of these dynamics. And you can't fight that huge force of nature by yourself, right? And so for me personally, my evacuation route was to leave academia. And I think by starting conversations like this at the Osher Center, we can begin to create new routes to help people stay in the field and also support them. So a few more quotes before I end. I told a friend it felt like I was being eaten psychologically. And she said they were consuming you, right? And so we can talk about these intellectualized ideas of extraction and profit. And what does it feel like to be the embodiment of from the people from which this is happening to? And to another friend, I said I was annihilated. And it doesn't make me happy to put this on a screen, but I have to share just the visceral, mental, physical distress that people go through, because sometimes you can't understand it if you don't belong to that group. And so I'll leave with one last question. What discoveries and connections are lost when people who belong to the culture leave the field? I hope people can recognize that we have inherent knowledge culturally, and we need to be present so that we can learn from each other and grow. Thank you.
So I'm here, my name is Sudha Prathikanti, and I'm here today to speak with you all about yoga and its cultural appropriation, both in the general public as well as in academia. And I just wanted to say at the outset that I myself was born in India, but came to the United States just as a toddler with my family in the late 60s. And I've personally witnessed, actually, over the decades, the shift in awareness about yoga. And I can speak a little bit to how that sort of entered the realm of mind-body medicine a little bit later on in the slide. But it's really been a very interesting journey to watch how yoga has been absorbed into Western consciousness. And the goal of my talk today is really just to share a little bit about the historical context of that process. As my colleagues, Helen and Helen Weng have already spoken to, yoga is obviously a tradition that comes from the East, that comes from India in this situation. And yet there's a way in which the many individuals who are of Indian origin in medicine and in healthcare today actually are not represented in yoga research and in speaking about yoga as mind-body medicine. And it's just really been something that struck me over the decades, but particularly in the last 20 years or so, when the field of integrative health has really exploded, that there's been such an underrepresentation of people of Indian origin in this field. And so I hope to shed a little bit of light on perhaps what might be happening historically from yoga as a colonial legacy. And that's the reason why I'm going to be talking to you a little bit about the historical context of yoga today. So let me just start by saying that just the definition of yoga, which many of you have probably heard before, but yoga is a Sanskrit word, and it refers to the union of individual consciousness with universal consciousness. And yoga is really an ancient wisdom tradition that dates way back to almost 3000 BCE. And the word yoga actually first appears in the Vedas, which are the sacred texts of Sanatana Dharma. And Sanatana Dharma is what later came to be called Hinduism by those who are actually not from India and who were actually from other countries, other cultures in their first contact with India. So since the people of the Indian subcontinent at that time were mostly settled in the Indus Valley civilization, Indus or Hindu. So then the people that came to practice this particular way of spirituality and way of life were called Hindus, meaning those that lived in the Indus Valley area. So it's a word that actually is not native to the culture. It's actually a word or a name that's been given, by those who came from outside the culture, and yet it's used now to describe Sanatana Dharma, which I always find quite ironic, because I have to describe myself when people say, what is my religious or spiritual background? I have to say, well, I was raised in a Hindu household. But that word itself is just something that is a little bit grating to use, because it doesn't really even come from within the culture. And that's something that I've been aware of for many years. But in any event, I also wanted to say, though, that yoga, even though it originated in Sanatana Dharma, in Hinduism, it's also over the years been elaborated upon and integrally incorporated into Jainism as well as Buddhism. So there's a very rich tradition of Indic religions, Hinduism, Buddhism, Jainism, and later on even Sikhism, which actually embraced elements of the yoga tradition. So it's really a very, very rich cultural tradition that arises from the matrix of the Indian subcontinent. Next slide. So even though obviously, yoga has existed for thousands of years in India, has been practiced mainly on the subcontinent for centuries, its first emergence into Western consciousness did not occur until the 18th and 19th century, which was the time in which India was under British colonial rule. And so it's very, very important to understand that this is a point at which yoga enters as a substantive presence in Western consciousness. It does not come, this awareness of yoga does not come from a context in which India was operating as its own self-determined, nation state. It was basically under European rule that it comes into awareness. And so, I could go on for a whole other talk in and of itself of the damaging effects of colonialism in India and in the diaspora that resulted even after colonial rule ended in India, but which, because India became independent only in 1947. But during the time period when the British were ruling India, there was a systematic attempt by the British to basically create a mindset within the Indian subcontinent of inferiority of Indian traditions, the Indians that were native, traditions that were native to India, including Ayurveda, including yoga, including many of the spiritual traditions. And in fact, one of the the ways that they successfully did that in certain areas was to actually make it illegal to practice those traditions. And so Ayurveda had to go underground. Yoga had to go underground in order to survive. Otherwise, you could be punished by death in some cases by practicing certain forms of those native traditions. And so it's in that context that there were certain luminaries, like in the area of within India, who were trying to maintain these ancient traditions that had survived for millennia, but which were at risk of being decimated and just basically taken off the face of the earth, within, a few decades. So Swami Vivekananda was one of those individuals in India in the late 1800s who was part of what was called the Bengal Renaissance in the state of Bengal, who were trying to bring back Indians' pride in their own native traditions, which under colonial rule had really been decimated. It became very fashionable in India at that time, if you were one of the sort of elite, to sort of talk about how uncivilized and superstitious and sort of ill-informed these native traditions were, and to instead embrace like European medicine or European, ways of understanding, spiritual philosophies and so on. And so Vivekananda was just a really central figure in sort of reviving, Indians' like sort of understanding of how ancient these wisdom traditions are and how much they've contributed. And it just sounds really just so ridiculous to sort of say that, but that was what he had to do. And so within that community, in terms of the Bengal Renaissance, he was identified by some allies that were British allies who actually thought that he was an impressive figure and he had some very important things to say about the contribution of India to science, religion, mathematics, and so on. And so they invited him to the World Parliament of Religions that was convening in Chicago, and they invited him to be a speaker. And he made a major splash at that conference, and speaking about yoga, speaking about Hinduism. And he also published soon thereafter a short pamphlet called Raja Yoga, which was really like in the United States, one of the first introductions to Western audiences of what yoga really encompasses. But it's really important to understand the political environment in which he was operating, and that there was a way in which he had to frame yoga so that it would be accepted within Western academic discourse, and that he could not talk about yoga in a way that would upset the status quo or make people wonder, like, why were the British there in India in the first place? Why were they profiting from the resources of India, both culturally and economically and politically? So he had to frame, yoga in such a way that it would be that he would even have a voice to even speak about it, and that yoga could continue to exist rather than be stamped out. So this was very, very important to understand. So anyway, I'm probably staying too long on this slide, but it's obviously something that to me on a personal level is just very painful. It's just a painful history to have to recount or summarize or talk about, because it's an aspect that's not actually, it's a kind of invisible aspect of yoga that's not even addressed in many academic environments. So I'm going to move on really quickly to the next slide. So another really important individual that I just wanted to share was really responsible for keeping yoga alive and bringing it forward into the modern day. And this is Krishnamacharya, who also basically became prominent during the time of British rule in India. He was a trained and very skilled Ayurvedic physician. And he was really particularly interested in the therapeutic use of yoga. And under British rule at that time, there was a real trend towards embracing physical culture. So that meant like how to build up a stronger body. And the idea was that if you built up a stronger body, you would also have a healthier mind, and that you could be more productive and contribute to the capitalist machinery of colonialism of the time. But, it was just a very dominant aspect of British presence at that time. So Krishnamacharya was pretty astute, and I think he was steeped in the very traditional Vedic origins of Ayurveda and yoga, but he understood that it was going to die out if there was not more of an effort to somehow make its utility to the West, visible. And so he really emphasized the therapeutic, the health benefits of yoga. And he focused on, within the many, many streams of yoga, there's a Hatha yoga tradition, which is medieval, and which sort of reached its ascendancy in the medieval period of Indian history. But he really combined some of these very classical Hatha yoga texts with some of the aerobic aspects of calisthenics and gymnastics to sort of make it, again, fit within the framework of the British colonial rule, so that they would see a utility from, keeping this particular tradition alive. And so he's really credited with being the developer of modern yoga. And his students, he never left India, but his students, who are Patabi Joyce, Iyengar, Desikachar, they went on to become the global yoga teachers who really, exploded onto the Western scene several decades, a century later. So next slide. So I'll just leave you with these questions. What's the difference between appreciation of yoga and appropriation of yoga? So one of the things that's just become really, really popular recently is calling yourself a yogi because you attended a few yoga classes. And this probably more than anything else is just so jarring to my consciousness when I hear this, because yogi in the classical cultural context of India is someone who has devoted their life to spiritual enlightenment. That yoga, coming back to that initial definition of yoga being the union of individual consciousness with spiritual consciousness, with universal consciousness. So yogi is someone who has dedicated themselves to that pursuit. And so it's all about that spiritual pursuit. So attending a few asana classes, postural yoga, practicing postural yoga does not make you a yogi. And also lots and lots of people that have claims that, oh, yoga doesn't originate from India. It actually, there's Christian yoga, and there's Egyptian yoga, and there's all kinds of other yoga, because the whole idea that it comes from India and comes from a particular spiritual tradition actually makes some people feel very uncomfortable. And so they want to decontextualize it and sort of use the benefits of it, but in a way that doesn't really properly acknowledge the cultural roots of it. And again, maybe yoga is even prone to exploitation in this way because it's a spiritual practice. Historically, there's been very little importance given to individual authors or developers of this tradition. And it's in fact considered to be worsening your attachment to ego, right? To sort of say, hey, you made this contribution, or I made that contribution. And that persists today, I think, in terms of how so many of the individuals that are perhaps drawn to doing research in this area may feel hesitance to actually put their names to some of the work that they're doing. Anyway, I'll just close there because I know I've probably gone a little bit over time, and I want to make sure there's some time for questions.
Thank you so much. I just really want to acknowledge all three of you, our panelists, coming from a place of personal experience, deep cultural roots, and sharing vulnerability in terms of these personal experiences and the harms that they've caused, and recognizing that vulnerability also is a form of strength. So honoring that in each of you.